Today on Minnesota and Company, treating fibroids. North Star Fibroid Clinic offers a safe, proven, and minimally invasive treatment for uterine fibroids. Historically, women have had very few options, but this new procedure ensures that fibroids will not return. Thanks for joining us today. I'm your host, Joetta Wright, and joining me from North Star Fibroid Clinic is Dr. Amin Astani. Dr. Astani, I am so glad that you are here today to talk about this.
Thank you, I appreciate that.
Yes, this is a very difficult conversation and we don't have it enough, so I'm grateful for this. And I'm wondering, can you tell us what are uterine fibroids?
Uterine fibroids are non-cancerous growth in a woman's uterus. They can vary in size from very small to large, and they can even expand the uterus. While some women with fibroids don't have any symptoms from it, others can have heavy menstrual periods, prolonged menstruation, pelvic pressure, pelvic pain, or even difficulty urinating.
This is great information, and another thing I didn't know until today is that women of color are at greater risk for developing fibroids, but all women get them.
That's correct. Fibroids are extremely common. Most women have them. Women of African descent are more likely to have them and get them at a younger age, but any ethnicity can and do get them. And this is a disease of primarily reproductive age, meaning that after menopause, the fibroids typically stop growing and shrink in size.
Okay, and what are some typical symptoms of uterine fibroids?
In some people, there is none, because fibroids are very common. Most people have them. They may not even know they have fibroids, but in some there could be severe symptoms such as very heavy periods, prolonged menstruation, heavy pelvic pressure, pelvic pain, difficulty urinating, or even in some could cause constipation.
Wow. And these are symptoms that you may not link to fibroids, so it's so important to have this conversation with your doctor. And I'm also wondering, how are fibroids traditionally treated?
There is a range of treatments for fibroids. If it doesn't cause any symptoms, there's no reason to do anything about it. If there are minor, minimal symptoms, sometimes oral medications can help alleviate some of the problem. On the other spectrum, there is major radical surgery such as hysterectomy or myomectomy, in which they either remove the entire uterus or go in and remove the larger accessible fibroids. Now there is this new procedure, new meaning newer than the rest, but is really not new, it's well studied, called Uterine Fibroid Embolization, or UFE.
And please tell me more about this. What is uterine fibroid embolization? How is it performed? And then also, what are the expected recovery and success rates?
Uterine fibroid embolization, or UFE, is a minimally invasive procedure. It's not a surgery, there's no cutting involved. It's done through a very thin, tiny tube, we call it a catheter, that we insert in a vessel, typically in an artery in the wrist. And through that, we navigate the catheter under the X-ray guidance to the blood vessel that supplies the fibroids. Oh, wow. When we're there, we inject these tiny particles to block the blood flow to the fibroid, so no more blood goes to the fibroid, they stop growing, they shrink, and eventually die. It's minimally invasive. Recovery after, and because it's minimally invasive, it's not painful, and recovery after that is fairly simple. For about 3 days or so, there are going to be symptoms of irregular, normal menstruation, and after 3 days, the symptoms subside, and women can go back to their daily activities.
So the risks are less compared to a hysterectomy or a myomectomy?
Absolutely. There is no cutting, there is no dissection, there is no incision. As such, risk of infection or bleeding or injuring vessels or tissues are minimal. All of those risks combined is less than 1% for UFE.
And I know this is a procedure that you at North Star specialize in, and you are very, very personal with your patients when we get there. Thank you so much for this information, because I know I needed to hear it. North Star Fibroid Clinic is located in Golden Valley. For more information, call 952-222-7594 or visit northstarir.com. We'd like to thank North Star Fibroid Clinic for sponsoring today's interview.